Welcome, Pat, and thank you very much for joining us. This is going to be a very brief question and answer in relation to your study, which was published in Muscle, Ligament and Tendon Journal in 2019, the title of which is Extracorporeal Shockwave Therapy for Healthy Achilles Tendons Results in a Conditioned Pain Modulation Effect, a randomized exploratory crossover trial. Bit of a mouthful.
Yes.
Okay, so can you tell me, Pat, you're a PhD student in Monash Musculoskeletal Research Unit. Tell me what motivated you? What sort of came over you to do this work?
Yeah, so we found a bit of a gap in the literature. So shockwave therapy, it's a popular additive therapy. It's often used alongside exercise rehabilitation. In the medium and long term, in the treatment of Achilles tendinopathy and tendinopathies of the lower limb, there's some good evidence for benefit, and mechanism is suggested for this short-term and medium-term benefit to be largely biochemically driven, and also maybe altered healing. However, immediately after application, there's also a reduction to pain, and right now there hasn't necessarily been any research performed to determine what that mechanism might be. So we thought we'd look to determine what this mechanism driving short-term pain reduction might be, and we went to the drawing board and thought, well, potentially there's some overlap with this concept of conditioned pain modulation, which is that classic pain inhibits pain paradigm. So you apply the shockwave therapy, it's painful, might potentially activate a bulbar center, and as a result you get this widespread pain relief. So we thought we'd explore that.
Fantastic, fantastic. So you had a hypothesis there that it might be conditioned pain modulation, and then you went to test your hypothesis. Tell me how you did it. What did you actually do?
Yeah, so we recruited healthy persons. We thought best to start with healthy population, in that in the literature, conditioned pain modulation effect is greatest in healthy persons. And then we could extrapolate or expand and research further as to whether this effect would be present in a pathological cohort. And we applied shockwave at two different doses. So a 3,000 and a 6,000 shock dose. And this was at two separate testing occasions. Before and after, we tested pressure pain thresholds. So a measure of mechanical sensitivity. And we quantified the pain response as being changed to pressure pain threshold from before to after. So we looked to see if there was a significant change in pain. We collected these pressure pain thresholds, it's also worth noting, at bilateral sites and sites in the upper and lower limb, so as to determine whether this pain response to shockwave therapy was diffuse and widespread in line with the conditioned pain modulation effect.
Fantastic. And can you tell me briefly, what did you find? What were the main findings?
Yep, so for the 3,000 shock dose, all sites significantly increased the pressure pain threshold. So that would mean a widespread and consistent reduction to pain sensitivity. Whereas for the 6,000 shock dose, while some sites did significantly increase, not all sites did. So we'd say from that the 3,000 shock dose consistently elicited a conditioned pain modulation effect.
Great, all right. That's a really nice summary of the findings. Can you tell me just just briefly what would be a take-home message or something that clinicians can take from this to apply when they're managing people with Achilles tendinopathy?
Yeah, I think there still is work that needs to be done to apply this research methodology to a pathological cohort. But you might consider what the response immediately after application of shockwave is, and it might be beneficial potentially to allow greater application of other therapies that would be of benefit. So exercise, for example, if it's too painful, without application of such an intervention prior.
And one final question. So in this context, do you think that pain does inhibit pain? And if that's the case, can you just hit them with a hammer?
That's a very good question, and a somewhat loaded question, I'd argue. I believe that to some degree, if you're eliciting pain, yes, you should get a pain response, pain reduction response rather. So I think you can absolutely explore different method to achieve this pain reduction effect, although you should also consider the short and medium term effects of shockwave therapy as well, where there is benefit. So yes, you can elicit pain to get pain reduction potentially.
But you wouldn't hit them with a hammer?
Not necessarily a hammer, no.
You've got to weigh up the potential efficacy with the potential harms, I guess, there with that one, Pat.
Correct.
Yeah, sounds good. Thank you very much for the chat, Pat.
Thanks for having me, Peter.